here today. My name is Dana Gerardo,
And I'm Dr. Blake.
and we're here today to talk to you about tinnitus.
So, what is tinnitus? Tinnitus is the perception of noise or ringing in the ears. It's a common problem affecting about 15 to 20% of people. It is not a condition itself, it's usually a symptom of an underlying condition. For example, age related hearing loss, an ear injury, or a circulatory system disorder. In almost all cases, tinnitus is a subjective noise, meaning that only the person who has it is the one that can hear it.
What can make tinnitus worse? Well, there are actually quite a few things, about 16 things that can make tinnitus worse. One of the first ones would be loud noises. Excuse me. When you have tinnitus or ringing in your ears, many things can make these noises worse. And the most obvious one is loud noise. Loud sounds from machinery, headphones, concerts can cause short term ringing or permanent hearing loss. It's very simple to avoid this. Wear hearing protection. Whenever you're on your lawnmower, you're on your tractor, or going to a concert, wear hearing protection. And let's not forget about the kids. Children's hearing is actually more sensitive than adults, and they need hearing protection too. So don't forget about those guys.
The next thing is medications. If you've ever looked at the back of your medication bottle and seen all the tiny print with all of the side effects, tinnitus is probably one of them. So this list can include antibiotics, antidepressants, things like Advil or Aleve, cancer drugs especially, diuretics, or high doses of aspirin. So usually the higher the dose, the greater the chance of getting the tinnitus. Sometimes if you stop taking it, you'll just notice that the ringing goes away. If you notice that the ringing continues, then you should definitely consult with your doctor.
Stress can actually cause tinnitus. It definitely makes the ringing seem louder. Find ways to relax to get it under control. You might want to try exercise or deep breathing. Massage or acupuncture can also help. If you have trouble doing it alone, consult your doctor. There are things that they can do to help you.
The next one is jaw problems. So any type of jaw issue, otherwise known as TMJ. So the TMJ joint actually shares nerves and ligaments with your middle ear. Problems here can cause pain and noises in your ears. You might notice like popping or difficulty chewing. If you have any of these issues, definitely consult with a dentist or an ear, nose, and throat doctor to figure out what's going on.
Earwax can cause tinnitus as well. Our ear builds up this gunky, nasty stuff, and earwax actually has a purpose. It's designed to trap dirt and debris and to help protect your ear canals. Sometimes it builds up and can cause problems that can lead to ringing and even temporary hearing loss. We can actually help you here with excess wax and get it removed for you. Remember, never use a Q-tip in your ear if you suspect that you have a wax buildup. Give us a call so that we can get you on the schedule and take a look inside of your ears.
The next one is an ear infection. So you might notice that after you've had a cold, that you have some ringing lingering in your ears. If that's the case, the ringing usually does not last long. If it does not go away, then you should definitely consult with your doctor. You may have developed an actual ear infection or a sinus infection.
Allergies as well. You may need to try an allergy medication to treat the symptoms, or maybe you need to change the drug that you're using. Consult your doctor or your allergist for advice on this.
Blood pressure is the next one. So if you know you have high blood pressure, keep it in check. Your doctor can definitely help you control it. Sometimes low blood pressure can even be to blame. So have your doctor keep an eye on that as well.
Sleep problems or lack of sleep can actually cause tinnitus as well. It's recommended that you aim for 8 hours of sleep every night. Not getting that sleep can actually trigger tinnitus. So if you need help falling asleep, contact your doctor. That is, we all want to make sure we have a good night's sleep and are rested the next day.
And the list goes on. So the next one is migraines. So migraines and tinnitus go hand in hand. The pain of a migraine can obviously make it worse if it robs you of sleep or ramps up your stress level. It's just a vicious cycle. So do whatever you can to ease the migraine, and the ringing should let up.
I hate to break it to you guys, alcohol is a culprit as well. Alcohol actually can boost your blood pressure and make you notice that ringing more. Try to cut back and see if you don't notice a change in the ringing in your ears.
Smoking. So, as if you haven't heard it before, kick the habit. The nicotine in cigarettes and other products can make the tinnitus worse. Smoking actually narrows your blood vessels that bring oxygen to your ears, so it can also cause your blood pressure to go up.
Another one that I hate to really hurt everybody with because I happen to have a coffee habit. Caffeine. Try cutting back on coffee and Coke, all this, or sodas. I'm a Southern girl, so I say Coke, and see if the ringing gets better. Caffeine can also raise your blood pressure, which can make the ringing more noticeable. Cut back and see if that helps.
Depression and anxiety. So, depression and anxiety can make the sounds you hear actually seem louder. Also, a big one are the drugs that you take to treat depression and anxiety. So, because having tinnitus can also bring you down, your doctor can help you find ways to feel better and manage those emotions.
There are also some other conditions that can, other medical conditions that can cause ringing, such as tinnitus, or not tinnitus, I'm sorry, thyroid issues or anemia. Some cause ringing, some make it worse. These autoimmune conditions can actually affect can cause structural problems within the inner ear. So contact your doctor if you find that you have noticed an increase in tinnitus and you do have one of these conditions.
So, the big question, can tinnitus go away? In many cases, tinnitus actually dissipates on its own, regardless of the cause. However, that doesn't mean that you should wait weeks, months, or even years for the tinnitus to just disappear. If you notice that it's continuing for more than a few weeks and it's negatively affecting your quality of life, consult with your hearing care provider.
You may be wondering what kind of treatments are available for tinnitus. One of the most common causes of tinnitus, of course, is hearing loss. And for most people, treating that hearing loss with hearing aids is the most effective way to deal with tinnitus. By treating your hearing loss, you can tackle the cause of your symptoms and minimize them significantly. We would love to help guide you through this process. Give our office a call at 704-845-1717, and we'll be happy to get you into our schedule to see how we can help you get rid of that tinnitus. Thank you so much for taking the time to join us today, and we look forward to talking with you soon.
Thanks for listening.